will hand it over to Maria and Jacqui. Welcome.
Thank you very much for allowing us to be part of this session. Jacqui and I will do self-introductions. Jacqui, would you like to start?
Sure. Thank you so much. This is such a great platform, and I really appreciate the invitation. My name is Jacqui Orie. I am an organizer with the National Domestic Workers Alliance and We German Black. My pronouns is she and her, and I'm excited to be here.
Thank you. And I am Maria Lemus, Executive Director of Visión y Compromiso and our national network of Promotores and community health workers. In Spanish, it is La Red de Promotoras y Trabajadores Comunitarios. And thank you very much for joining us for this session. Jacqui, would you like to start with describing your organization and the work that you do a little bit?
Sure. So we are the National Domestic Workers Alliance, NDWA, and we have over 70 affiliate organizations across the country. We have 6 chapters across the country. We have a chapter in New York. We have a chapter in Atlanta. And we are about educating domestic workers and lifting up the voice of domestic workers throughout the country. We represent over 2.5 million domestic workers, and it's really about lifting up the voice and the power of domestic workers across the country.
That sounds like an amazing organization. And I think we're a natural pairing here. Visión y Compromiso, we're now in our 20th year. Right. And we provide capacity, training, leadership, and advocacy for promotoras and community leaders. Not to be confused with community health workers, although many of us are community health workers, but we're also that community branch, the community members, mostly women. We're 95% women. We're right. Primarily Spanish speaking, and we're primarily immigrant. And it's a great combination that we speak of here between the two of us, because I think that's much of our constituencies. Jacqui, I understand that you have a campaign going on that I think might benefit both of us. Can you tell us a little bit about that?
Yeah, sure, Maria. Thank you for that. That's such a really, really big campaign, and we're so proud. It is the National Domestic Bill of Rights that we have introduced into Congress. Is the very first bill of its kind, the very first bill. And I'm really, really proud that we have introduced that national bill. It's the first legislation that protects the rights of domestic workers across the country. When you think of labor laws, most of our population of domestic workers were excluded from labor laws. The labor laws were designed that domestic workers were intentionally excluded from workplace protection, and workplace protection like minimum wage and overtime. So the National Domestic Worker Bill of Rights addresses these exclusions of the past, and it really brings us closer to a future where all work is dignified work, and where every last job in America is actually a great job. And this bill does this by including domestic workers in common workplace protection, such as, like I said earlier, paid overtime, safe and healthy working conditions, and freedom from sexual harassment. It also includes rights and protection that addresses the unique challenges of domestic work, such as paid sick days, contracts, meal and rest breaks, fair scheduling, support for survivors of sexual harassment. The National Domestic Worker Bill of Rights also ensures that rights aren't just on paper, but that they can be enforced. And so the Know Your Rights information, the mechanisms against retaliation is really, really important, really, really important. Again, this is the first national legislation of its kind to protect domestic workers across the country.
Congratulations. It's such a feat to be able to say that it's a national bill. Can you tell us a little bit, because I think it is an area where we might have commonality. Can you tell us a little bit about who are domestic workers, the titles, the roles?
Sure. So domestic workers, care workers, they are the 2.5 million domestic workers in the United States. They are nannies, house cleaners, care workers that care and clean for our nation's families. They take care of our disabled and elderly family members, and they clean our homes. 90% of them are women. The majority are women of color and immigrant women.
I think, Jacqui, that is where we have a commonality. Visión y Compromiso and our network of promotoras are primarily mothers and grandmothers. They have children and they have families to take care of, but they're the ones that are in the community giving information day to day. They're in the fields, they're in the communities, they're on the streets. They're really handing out information and being that trusted messenger. And they have no rights also. We have Visión y Compromiso is the largest associate organization of promotoras and community health workers in the nation. And we advocate for them as workers. One of the areas that we're strongly involved in is workforce, really moving community promotoras into workforce so that as jobs open up, they're the ones who should have that employment opportunity. It's interesting because, as you mentioned, labor laws, we haven't moved into that area yet, but I think it's a really important piece where as we're joining the employment sector more in greater numbers, those things are going to come up. We have some papers that we developed a few years ago talking about workforce and the integration of the promotor model that really looks at the organization and the way that they embrace that person, from the receptionist to the executive director to the CEO. It is a process. It's an acknowledgement of the characteristics and the value of that individual and what they bring to the organization. And we've been really advocating that as positions come up, especially with this new funding that the Biden administration is aggressively seeking for community, that they be at the forefront of that. And I think the bill, I think we should have a discussion on how we can include promotoras in there somehow, because they're also the essential workers in the community. And what kind of support are you looking for, Jacqui?
I mean, when I think of the care industry and you think of domestic workers, all part of the care industry, and we actually think of the crisis that they have gone through, the economic crisis, the global health crisis, a long history of racist policies and discrimination, we understand that, or we should know that the economy should work for all of us, not just for a privileged few. And as you know, this caregiving industry is made up mostly of Black, Latina, and Asian women and immigrant women. And we are hoping that the employers will form alliances with domestic workers. We are hoping that care work is put at the center of the policies that our legislators are putting forth.
As you know, a very important point, Jacqui, about the impact that the pandemic has had on those of us in that field. We know that promotoras have been laid off in greater numbers, and because they're volunteers and they're on soft money, they're usually the first ones to go. But they have suffered in high numbers with COVID and have little resources. So we find ourselves with the network developing support systems, giving food out, finding out who's sick, doing the navigation of resources. And without any funding to support that, our community is suffering more. They are those numbers that are highly infected, that have become ill, and who are suffering right now, whether they're in farm workers or whether they're essential workers in the city. I think that the care for those of us in the grassroots level is really important. I think how we can partner is certainly that way, that we can join forces across the nation to say that domestic workers / promotoras also need to be advocated for and supported as we enter the work field. Informally, how many informal domestic workers are there and caregivers?
Across the country, there is about 2.5 million care workers, domestic workers across the country. And in New York alone, there are over 200,000 domestic workers and care workers, domestic workers, I should say.
We found that there's a lot of informal caregivers, and our work now is in supporting those informal caregivers, in particular, the grandmas and the aunts who are supporting children.
Right.
But family members who are supporting family. I think it became an issue for us, or it was highlighted more with Alzheimer's and Parkinson's, but really caregivers are for anyone who needs assistance in a family, whether they have a chronic disease, they broke a leg, or they're ill for something. We're the caregiver. I wonder how that could be part of the domestic workers alliance, these informal caregivers that we support.
You know, most of our base actually are undocumented, and I think that's what you mean by informal caregivers. We call them undocumented caregivers, but they do amazing work. And so because these workers are undocumented, they have been excluded from a lot of resources. And what our congressmen and women, our representatives, do not understand, they have not yet grasped, is that domestic workers, care workers are part of the backbone of care in our country, helping with seniors, people with disabilities, and those caregivers provide assistance daily to our families. They basically are the thread that hold families together, but yet they are kept out of protection. They were excluded from even receiving funds from the nation. And so we want to ensure that our caregivers, whether documented or undocumented, are the center of any policy that our government is putting forth. And we understand too, not to cut you short, but we understand too that the Biden-Harris have an economic plan in place to invest in Black and Latina and Asian to build the caregiving infrastructure. And we hope that this plan, as it is put in place, that it really passes and that everybody truly understands the importance of care work to our economy.
Many years ago, they used to call that the underground economy because nobody spoke about it. And it was my grandmother taking care of my child or those kinds of things. But now it is a majority of our economy, and that money that's transferred across hands from a mother to a provider, whether they're taking care of their older adult or they're taking care of their child, right, is a large contribution to the economy. I think that for us, the issues of documentation become more present as we start to look at ITIN numbers, for instance, or we start to look at documentations, and how is it that we can include them as part of the workforce officially so that they can benefit from some of these things that are coming down the pike. Social Security, health benefits, those kinds of things. Does your plan encourage that or allow that?
We actually do. Recently, we had a webinar where we were educating workers on taxes, and we in New York have just won this huge victory for excluded workers, undocumented workers, workers who do not have the ability to get funding from the government. And so we had this huge victory called the Excluded Worker Plan, the Excluded Worker Fund, where we are ensuring that domestic workers and care workers are able to get some kind of assistance, because believe it or not, they were the first ones to lose jobs, to lose income during the pandemic.
Exactly, and that's what we're experiencing. And they're the last ones to seek resources. They're the last ones to go to food banks. They're the last ones to go and right now step up and get a vaccination. And so I agree with you. I think that we should work together to look at those mechanisms at the federal level to see how we can support collectives. For us, colectivas are an option also. And the ITIN is a really important piece. It's an old strategy with the government, but I think if we can loosen that up and allow our informal caregivers or our undocumented community to take advantage of that and to be able to work and receive benefits in the long run. They're already part of the major economic force in the United States.
Right.
How can they now benefit from some of the things that are offered?
Well, I can answer that question. You see, domestic work is rooted in the history of slavery, and it is that legacy that continues to shape the sector today. And that's why, you know, it's low pay, exploitation, abuse, sexual harassment, wage theft, lack of labor protection. That's where all of this is coming from. It's because it's domestic work and care work is really rooted in the history of slavery. And that legacy is continuing to present day.
I think it is that paternalistic perception of who from my perspective, who promotoras are, that they are, quote, just a promotora, and diminishing their skills and abilities and their contribution to workforce. When we see in the pandemic, that's who they went for. That's who they're contracting with, the CBOs, to go out in the community, because no one can reach us except us. And you know, the saying that we're hard to reach, we're not hard to reach, you just don't know where to look for us. And so that's where promotoras and the domestic alliance really comes in is important today.
You know, one of the things I really really want to share is that the importance of how care work is, the importance of care work, and really what that has shown me, even as we went through the pandemic, and we're coming out of it, thank God, and hopefully it continues that way. But it really highlighted what domestic workers knew all along, what we as domestic workers, myself, who was a domestic worker for 20 years, we understood that we were essential. We knew that about ourselves. For some reason, our nation didn't know that about us. But the pandemic highlighted how important, how essential care work and domestic workers are to the economy, how it is the engine really that drives our economy, how it allows families to go to work to take care of their own family. And so when I think of home care workers, caregivers, nannies, you know, they're at the front line of this pandemic, but for some reason, they're not being taken care of. For some reason, they're caring for workers, they're caring for families, they're caring for homes, they're caring for our loved ones, but they're not being taken care of. Their health are at risk.
Totally agree. I totally agree. And what's interesting is this backdrop that I have as a corazón, as a heart, and we believe that the promotor is there because of their service to their community. We call it espíritu de servicio. And that is the essential worker. That is who you're talking about, those mostly women for us who are in the community, helping, giving information, guiding at their own risk. And like you mentioned, those groups who were out there right now taking care of children, promotoras are out there giving information, going in the fields at the risk, because they believe in serving their community. And I think it is a much misaligned and uninformed and disrespected view that the agencies, whether it's at the state or the federal government, I'm hoping that with the new administration and their support for community health workers, that we hope that also includes support for community, which would be promotoras, leaders, and certainly domestic workers, and all those that are at the forefront right now. I don't know that it has, they have detailed it that way, but I'm hoping through this webinar, if someone's listening, that they should invite you and I to the table to say, this is the constituency that we represent. These are the thousands upon thousands of domestic workers and promotoras across the United States who are day to day doing service to their community. What else could we say to them, do you think?
I really do agree with you. You know, it's the same way we need infrastructure, we need bridges and we need roads. It's the same way we need a care infrastructure, right? To help, and that it's built around our families and consumers and workers and our economy. What we want to ensure that the people out there here is that care jobs should be not just good jobs, but great jobs, well-paid jobs with benefits and trainings, that workers have the ability to join a union, and that long-term care and care services should be accessible and affordable, that our workers should be respected and seen as the care worker that they are, that they're treated with dignity and that they're treated with respect. And they are treated like human beings.
I agree. We do talk about the promotor as being central to all of the work that goes on in our community. And we believe that a job is probably the most important factor that will change social determinants. That if you give a family, if you give a person a job that brings money into the family, they can buy food, they have transportation, housing, and yet we're not paid. Most promotores are volunteers, and yet we're not respected as being the essential workers that we are. So I think that's a great message to give, Jacqui, to move forward with in unison between Visión y Compromiso and the Domestic Workers Alliance to really advocate and advance those, I don't want to call us essential workers, but we're critical. We're core to the community and we're core to the work.
You know, I wanted to ask you this, and I know that you may have answered a little bit of it, but tell me, because we are pushing a national bill for domestic workers and our caregivers, our domestic workers who are the caregivers of families, how does that apply to your community?
Well, we initiated a caregiving program not too long ago, and it happened because Promotoras, again, remember, they're the ones that are in the community helping community, but helping their families. They're the ones that are the social navigators, the medical navigators. They're the ones who interpret, who do all that. And so we started to this caregiving program focusing on them, the support that they need, the emotional support, as well as the technical support that they need to do their job, whether they're volunteers or not. And that turned into a Family, Friends, and Neighbors informal caregiving project for children 0 to 5, which is huge. It has changed the trajectory of these aunts and grandmothers and cousins who are caring for children. It's been amazing. And now we're evolving that into older adults, for instance, for chronic disease or Alzheimer's or Parkinson's, really supporting the caregiver. And I'm hoping that, listening to you, I'm hoping that these informal caregivers will be able to get some formal recognition, but also some compensation. They don't all want to work for IHSS. They don't all want to or qualify to work for IHSS or those kinds of systems, but they're doing the work. They're there day to day. They're helping. And so I'm hoping that they will get some recognition and some compensation for the work that they do. But more importantly, we're here to support them with that day-to-day struggle. It's the recognition and the emotional support and the learning how to do this the best way that you can.
Yeah, I totally agree with you, and I'm with you on that. You know, one of the things, you know, I know one of the areas that I spoke about earlier, and I know that it's dear to your heart as well, is how they are undocumented and you call them informal, and how they miss out on so much resources. And one of the things that President Biden and Vice President Harris, they're talking about is a process for qualified current and future home care workers who are undocumented to gain citizenship, right? And we really hope that this legislation, and if there's a congressman, a woman, a representative out there, that they would hear the heart of the Domestic Worker Alliance, the National Domestic Worker Alliance, you know, just pleading to understand that the key to a good job is to work with dignity and with safety and stability. And for this reason, the legalization of immigrant workers who are undocumented, and I know that is something we share in common, must be the central pillar of transforming care jobs into good jobs. You know, and one thing I wanted to also share with you that we're doing in New York City, right? We are fighting really hard and just really calling on our Speaker, Corey Johnson, to really ensure that domestic workers are included in the human rights law. Right now, our workers are working behind closed doors. They are doing such amazing work, but yet still, they do not have human rights. Why? Because, again, they were excluded. Why? Because this work is done by Black women, Latina, Asian, but women of color, immigrant women. And so we're hoping that even in New York City, as we continue to stress and call on the representatives and Speaker Corey Johnson, that he will take this bill to a floor, and that bill will ensure that domestic workers have or are included in the human rights law.
So I think we could certainly learn from that effort, and I'm happy to continue the discussion and to see what we can learn. And we do have legislative days where we take promotoras to our state capitol and they walk the halls advocating for bills, whether they're a resident or their citizen. And that's an important acknowledgement that they have a voice. They may be a resident here, but they have a voice to change at the local level, at the county level, at the state. And we've even taken them to the Washington, D.C., to the Capitol. So I agree with you, advocacy is core. We do acknowledge that that immigration is a point in time. When my parents came in the 20s, they actually sent flyers to Mexico and said, come, it's a new land, come and join us. And so they came. And then in the 40s it changed, in the 50s it changed, in the 60s you had the braceros. And so immigration and is a point in time, it's a political point in time. And today it's a very difficult situation. We're hoping that we can bring together these allies in the Senate and the Congress to really see that we're here. I mean, I think it scares people to think that we're moving into a minority-majority state or majority-minority state, but I see it more as that's the natural evolution of the United States.
Right.
That is what we asked for when we said, give me your hand, your tired hand. It said, come and join us. And we should revel in that. We should enjoy the diversity amongst ourselves and with ourselves. So I'm hoping that other legislators will see the advantage of joining with us in changing the United States for the better, to allow everyone to have an equal voice and equal benefit from all of what the United States has to offer. As a person born here of immigrant parents, and born during the era of segregation. I'm that old that I was born during segregated America, that you see things change, but you see them change incrementally and not enough for the times that we have today. Yeah. Especially today in the celebration, not the celebration, but the acknowledgement of George Floyd's death, when you think things have changed dramatically, and yet here we are. I think to acknowledge the bill that you're moving forward would be a great thing, to acknowledge that our community is not only diverse, but it's a wonderful diversity, and we should enjoy and benefit and support all of our residents and citizens in the United States. So I'm hoping that's what we can help you support in that.
Yeah, and I totally agree with you. You know, it's really sad, but we're just hoping that our men and women our representatives in Congress and our employers out there, and, you know, our president and our vice president has done a great thing, and they have brought this huge, we consider it a huge win, you know, but still we want to ensure that employers and those out there who have not said anything and being quiet is basically agreeing with, you know, domestic workers not receiving or not being treated as they should, or not being taken care of. And we understand that, you know, historically that work was done by enslaved Black women, but right now they have the ability to change. We have the ability to include them. We have the ability to make a change. And so although these exclusions were created, you know, as a breeding ground for exploitation and invisibility, we are hoping that in 2021 that domestic workers will be able to earn, you know, at least minimum wage, that domestic workers, because now some workers are not earning minimum wage, that at least care work and domestic work would be great jobs, would be seen and valued, and that domestic workers would not lack protection, but they would be protected. They would be included in protection in laws that are dignified, to ensure that there are safe working conditions, and that it is not just based on, because right now domestic workers and care workers are really focused, or really leaning on the goodwill, I should say, of their employers, right? And we want to ensure that it's not just that, because there are so many workers out there who are being exploited, who are being taken advantage of.
I think one of to build on that, one of the things that we're doing is to build up the capacity for the individual to acknowledge that, and to say, I want a better condition, I want pay. There are some caregivers that don't get $20 a week to care for a child for 12, 14 hours. And
Wow.
And they go, well, pobrecita, they can't afford it. And they go, you know, there's all these dynamics that go on, and much of it is not understanding the worth of what they give. Now, I'm not suggesting they, you know, charge extraordinary amount. It's within the family's ability, but their self-worth and their acknowledgement of the important place that they have in the development of that child. We've seen extraordinary results where now they not only acknowledge the importance, but the parents are acknowledging the importance. So it's a win-win. And I think to advocate at the community level as well as to advocate with our legislators is going to be critical, and building up the capacity for community to engage in its own discussion, to be forward with their demands and their requests, and to really understand their special role. You've done it with the Domestic Workers Alliance, and we have started that with Visión y Compromiso and our advocacy with informal caregivers, saying you are important and you have a right to salary, you have a right to benefits, you have a right to health care and to other things. And one of the things that drives us is the dream that we come here with the dream for a better life for ourselves and our children, mostly for our children. As my parents came here and wanted a better life for us, and I want for my children, as I'm sure you do for yours. Across cultures and across races, that is what we have in common. And if we focus on that we all should live in harmony and be well educated and be healthy. Our vision is hacia una vida digna y sana, which is working for a dignified and a healthy life. The dignity part is that we shouldn't have to work like a dog to live here. That we deserve to be healthy. We deserve to have a home. We deserve to have our children free of illness. And those are the things that are just humankind that are common to all of us. So we're hoping that we can build the capacity of our community to engage in that discussion, as you have with the Domestic Workers Alliance. So I look forward to learning from this experience that you have and the success that you've had. And we'll join you in this advocacy.
Sure, thank you. I mean, I cannot agree with you more. You know, our domestic workers, the women who sacrifice so much, who sacrifice their own families, who went to work throughout the pandemic. They went to work throughout the pandemic to take care of other families whilst their own families were at home. They could have gotten sick, but that sacrifice they made because they understood the value and importance of care work. And so,
and also our essential workers, you know, I'm thinking about all of our farm workers who were out in the fields, all of the grocery clerk workers who were out there, all those people who were dedicated to their community, and the little regard that our system has for them. So I'm hoping that we can start that movement together. I really look forward to that, Jacqui.
Sure.
Let me ask and see if there's any questions. I'm not sure who's going to do that. Keely, Meredith, Michelle?
Maria, no questions have come through the chat yet, but if folks have questions, they can either chat them in, or if you'd like to come off mute, you can also ask your question that way.
Do Michelle or Kelly or Meredith, do you have any questions for us? Oh, Jacqui, do you have any more questions?
Sorry, trying to get off mute. I do have a question in terms of in listening to both of you talk, you know, and looking at how you can align in efforts and thinking about today, and that this is caregivers across the spectrum, you know, whether it's through this conversation or what has been your strategy before this in terms of bringing other groups in to align with you on your advocacy work, whether it's, you know, whether it's somebody who's the same group or different groups that bring just collaborative strength. If you could talk a little bit about that.
Jacqui, you want to go first?
Sure, and I'm going to really talk about two things, not just the the care package in New York, but also the Federal Bill of Rights that we have actually, it was sent actually to Congress in 2019. And that was for us a huge win, just to be in Congress, to be taken through, to be, at least for us, that was a huge win. And we could not have done that without our affiliate organizations. Like I said earlier, we have over 70 affiliate organizations across the country, and they are building with us and working with us and in community with us. We also have, organizations that are run with parents, and one such organization is Hand in Hand, the employer organization, and which are really helping us to transform this work, helping us to build and to raise and lift up the voice and the power of domestic workers and care workers to our Congress representatives, to Congress, to our president, to our representatives, to ensure that they hear us, to ensure that they see us, they see domestic workers, they hear domestic workers, and they understand the value of the work that domestic workers and care workers are giving and sacrificing to ensure that this economy and this nation continues to run, to ensure that our elder men, mom and dads, our children, our homes are kept, our families are kept in the way that employers now can go out and work so they too can take care of their children.
I do like the phrase "in community." I think that's a really important phrase to use, that for the community health worker promoter movement across the United States, it's relatively new. And so, historically and across the world, we have had promotoras working in India and China and Latin America. And the concept came to the United States, I'd say in the 60s, 65, 67. And then it's evolved over time, primarily at the community level as a promotor working in the Spanish-speaking community and developing all of our resources and our curricula and developing the promotor community across the United States. Most recently, though, it's evolved into a community health worker movement. And APHA really highlighted it in the early 2000s, at least when I was going to APHA. And it evolved into now Promotor Community Health Worker Movement. And I'm proud to say I'm part of the National Association of Community Health Workers, but also really contributing to that in a large way by highlighting the community piece and the Promotor movement across the nation. So all that to say that in community has not totally happened for the promotor movement yet, at least the Spanish-speaking promotor. We are finding the commonalities. We're discovering each other across the states. I mean, I was in Missouri and there's Latinos there. And in Missouri, I was kind of amazed. And I've been to Alaska, I've been to different places. So I know that wherever there is, at least for the Spanish-speaking community, wherever we have large numbers of Latinos, you're going to find promotores, and you're going to find, because that promotor is that mother and that grandmother, and so we're a natural part of that. Now, politically, because of the emphasis on community health workers and promotores, and with the Biden-Harris administration acknowledging the importance of these caregivers, whether they're social or family caregivers, it's important for us to form this alignment and this in-community piece that you speak of, which I love the term, and I'm going to use it because I think instead of talking about partnerships and talking about alliances and talking about affiliates, it's really in partnership. It's together. We're equal. We're all wanting the same thing. So we've started to form this group in community where we can come together, share resources, but more importantly, advocate together, which is what I think the Workers' Alliance has done so well, is find commonality and work on those issues together so that we can advance well-being for all of our Spanish-speaking communities, whether we're Dominican, Puerto Rican, Mixteco, indigenous, from Guatemala, from Central America, from Spain even. And then especially our Afro-Latino community, which is growing in numbers across the United States. As an aside, in New York, when I was in New York just recently, it's Afro-Latino, but when you're in Los Angeles, it's Blaxican. And so the language even shifts because of the community. And I think that we need to honor that and to see how we can bring that forward. So I'm going to take that with me, Jacqui, that in community, because I think that's an important piece for us to acknowledge as we, as a Spanish-speaking Latino community, move forward and see how we can organize across the U.S. and bring that voice forward and join you in that. That's what I look forward to.
Wow.
So I see one question on here from Jacqueline. Does somebody want to read it? Do you want me to?
So Jacqueline was talking about the advocacy piece and how some organizations may shy away from advocacy and policy, and anything that you can say to how to encourage more community-based organizations nationally and locally to get involved in policy.
You know, for our part, it has been a path. It has been it has not been easy. One, to really, I think, introduce policy and change at the local level means that my Mexican mother, who came here, who didn't speak English till the day she died, has to understand she has the power to make change. And that's a process for many communities. And in some communities that are really overwhelmed with discrimination and practices and such, it's difficult to move outside of that. We've been very successful in Visión y Compromiso with our legislative days, and right now with our advocacy, moving forward, issues that are important at the community level. But it does take understanding the system, it does take having advocates, and it does take having leaders at the local level, and that's building community. I don't think it just happens. And so we're 16 years into our legislative days. We've had changes, but now we're getting ready to submit bills. Just like Jacqui, we're gonna, this next session, we are going to be active in that role. And that's building leadership at the local level.
And I also want to add to that. I want our organizations, our affiliate organizations, those who out there who are a little bit hesitant about being in community with us to fight for policy change, to remember that caregivers are the backbone of our economy and our everyday lives. And at some point in our lives, everyone will need care or may need care if they have the privilege of getting to the age where they will need care. But at some point, everyone will need care. And although, you know, the $400 billion in investment that President Biden President Biden and Vice President Harris spoke about, it's a huge win and a historic win for care workers. And this was all done because of lobbying and the visits to Congress and to Washington and the town halls and the calls and the petitions and the stories. You know, vital services could be expanded to people who need it most because we continued to push and we continued to push. We did not give up. We have our feet in the front door already. So we have our foot through the front door a little bit. But now we need to continue to push for Congress to ensure, to make this commitment a reality for our families. And we have to keep the pressure up. We cannot back down. And so we're reminding our affiliate organizations that it's not just about one spectrum. It's not just about one sector of the industry, but it's care throughout the industry. It's not just domestic workers, but it's caregivers, essential workers, it's house cleaners. We must continue to keep that pressure up on our elected representatives to continue to make our voices heard, to continue to make our stories heard, to ensure that that $400 billion that President Biden promised is included in the final legislation, and we cannot give up.
So one thing I agree totally with what you say, Jacqui, and one thing that's important is the devil is in the details. And so while there's a large statement of X number of dollars that's going towards this initiative, how those details are carved out, who those communities benefit, what's the understanding, what's the pathway, what government agency is going to be in charge of it, what restrictions are they going to put on those funds. It seems that the bureaucracy has while it's well intended and it's there as a guardian of the federal funds, has its own guidelines. And so it's important for all of us to work together to help support those agencies and understanding what the needs are at the local level. We have discovered that even more as we're partnering with other agencies.
Right.
We are joining forces, whether we're Black or Latino. And even I was invited to go speak and do some training in Kentucky with a group of local Kentuckians who were not people of color. And I said, well, are you sure you want me there? And they said, well, the issue that they were interested in is poverty. And when you think about it, poverty goes across all race and ethnic lines. So these funds that are going to support issues, really, we should come together, whether we're African-American, we're Latino, we're Asian, we're poor white. I think that it all benefits us. And so we should look at it in that commonality and go forth and advocate together for a better life for our children. As I said, my child and your child and everybody's child should benefit from this, from a good and healthy life and future education. And as we get older, and as an older adult, I want those benefits too. I want someone to come in and care for me when I need it. I want to have health care. I don't want to have to suffer in my older age because there wasn't a system that could take care of me. I know too many older adults who are alone in their homes, who don't have medicine, who don't have care because they don't qualify. And nobody should suffer that. I sometimes will tell policymakers, think about your mother.
Yeah.
And stop intellectualizing the system. That's when the DRPHs and the PhDs, the MDs think all this strategy is really great. But in fact, would that work for your mother? Would this process, would this system work for her? And break it down, because it doesn't work for our community. And some of the best laid plans are exactly that, they're plans, but they're not realistic because it hasn't had Jacqui at the table or me at the table talking about what's realistic for our community. And so while I think this amount of money that the government wants to support our communities, we need to be at the table. We need to really see how that's going to be distributed and what way, to who, how, and when. So I do encourage that they contact us and they really get community at the table to help distribute this.
Yeah.
Thank you. I do have a question, but I wanted to see if any audience members had a question before I jump in. But just kind of building off of what you just said, Maria, and the legislation that has been proposed, you know, if you had a magic wand and you were in charge of distributing those funds, what would be your priorities? How would you and Jacqui, to both of you, how would you invest that money?
I'm going to let you go first, Jacqui. Pardon? You let me go first?
Go ahead.
Okay. This is really a great question. When we started advocating, we wanted to ensure that, that there was an investment in care work, with well-paid benefits, with professional training and development for caregivers, to ensure that caregivers have the ability, have retirement. Our caregivers and our domestic workers, sadly to say, there is no plan for retirement for them. And it's really sad because I think of myself. I'm happy that I work with this organization and I have the ability to support domestic workers. But when I think of care workers and domestic workers working day in, day out, sacrificing themselves, sacrificing raising their own children to help raise another family's children, or to help take care of another family, because they love this work and they understand the value of care work to an economy, and to understand that when they get to a certain age where they need to retire, there is no retirement plan.
I agree. I agree, Jacqui. I think when we think about that, I think that's a great place. The same thing for promotoras who are out there volunteering. And I think of the woman who called me when she had, during the COVID height of the pandemic, her husband had passed away a few years before. She didn't have Social Security. She didn't have retirement. She had COVID. She had nowhere, nothing. She called me and I helped her, and we set up a system of support. There's so many in caregiving, whether they're promotoras helping, giving information, or helping their families, and there's no recourse for them. So I think that for me, it would be supporting community. It would be engaging with community leaders to give the money to community. I think giving money to the state and to the county, while that's a traditional system, it's also a roadblock to supporting community. Community is a warm handout. We're the ones who are creative, who are developing systems of care, and who are supporting our families when other systems in the bureaucracy aren't able to do it because of their own constraints, their own systems that they develop internally. So if you ask me what I would do, I would give it to community, and I wouldn't give it to the big companies that have been around for a long time, not necessarily the big guys. I would give it really to the community-based grassroots organizations. You may have to use a grassroots intermediary, but you have to build up community capacity to engage in the discussion, to be able to continue to support our local caregivers, to be able to support our local systems. Otherwise, it's always going to be the big guys, the big nonprofits. I won't name them, but the big ones who just continue to maintain their own development, and very little trickles down to community. And I hope we leave with this picture that Jacqui gave of the caregiver and the promotor who has dedicated their life to helping others. And if they're fortunate enough to have Social Security, they live off of $600 a month. And if they're not, they live off of the generosity of their family. And that's just not the way it should be for somebody who is caring for your family.
And I also want to add to that, most of our workers are not able to take vacation or paid leave, get leave with pay. And so that's another place I would invest that in: permanent paid leave, access to health care, access to childcare, universal childcare, which is something that we've heard throughout campaigns, but we want to ensure that really becomes a reality for our families and for the families of our caregivers, for our domestic workers. So paid personal leave is another area that I would ensure that money is spent, as well as healthcare, that our caregivers who are taking care of families also have the ability and have the resources to take care of themselves and their families as well.
And maybe even housing. There's so many other things that impact a family, a caregiver who is already has little support. Housing is really critical. Support for the educational system around them, parks, and all these things that we talk about, making a happy child grow and a family be robust, don't exist in marginal communities and don't exist in poor communities. So when people develop these master plans that have walkways and have parks, they're not in our communities. And so how can we support and invest in those so that the family of the caregiver also benefits?
And Maria, also, these families have children, right? Universal childcare is so important. I really, really hope that, that's an area that is really invested in, because these are families who have to go to work. They go to take care of other people's children. And it would be really wonderful that they have a place that they can put their own children so they can go take care of the other family. So yes, definitely universal childcare as well.
My husband is a former educator in early childhood ed, and seeing the importance of having affordable childcare is just, it's incredible, and good childcare where the facilities are beautiful and new and shiny, and no disregard because they're not to be disregarded because the community is poor, but really highlighting that this is what a child should go play in a place that's clean and the food is good and the environment is happy. I think that's what we look for our children.
No, I so agree with that. You know, I cannot stress it enough how essential, how vital care work and domestic work is to our economy. And I will always come back to New York City, of course, the whole nation. But right now we are really pushing for domestic workers to be included in Intro 339. We're really pushing for domestic workers and care workers to be included in human rights law. Can you believe these are people who are taking care of your most prized possession, the people that are dear to your heart, but they do not have human rights. I
agree with you.
And so we really want to ensure that our care workers, our domestic workers also have human rights protection, and that the investment is made in that home care workforce. That investment is made in the home care workforce.
And for promotoras and our communities of promotoras and community health workers, that we really invest in paying them a livable wage, that we support them with all of these things in their community, that we allow them to be part of the discussion on the well-being of their community, and that they become fully participant in what happens to them and their trajectory as a workforce, and not have others speak for us. We are a national organization, and there are a lot of regional networks. We have a voice. You don't need to look for who are the promotor representatives. They are not the DRPHs, PhDs, and MDs. They are like myself, a promotora. We are mothers, we are here, and we're available. And I would encourage anybody to go to your experts in the field, like Jacqui and myself and other regional experts.
Yeah. And I also want to speak to the employers who employ these caregivers, because we're looking for affiliates, not just our congressmen and women, not just our representatives, but we're looking for people even outside of politics. The employers who employ caregivers, the employers who employ domestic workers, to be in alliance with the workers, right? So that we can continue to build that community and to continue to uplift care work, and to help us call on legislators to recognize that this work is important work and is crucial to changing the culture of care and the domestic worker industry. It's crucial.
There are many examples of that. I agree with you. There's one example I think of in the Central Valley where this company wanted to invest in its employees. And so they built health centers in the key towns where their employees were. And they paid for, they built new, they almost rebuilt the little towns, and they built these training centers and a high school, and they give scholarships for college, all this for the families of the workers. And we're training the workers and their families, because they know that a healthy individual is a healthy workforce, is a healthy company. So they're investing in their own company well-being by investing in their workers. And I think that's a really good point, that we need to partner with these agencies. Where are all the tech companies? You know, where are they in partnering with community and the well-being? Their employees look to caregivers. Their employees are the ones who employ the nannies and they should be the partners in this movement, and they should be the partners in supporting promotoras to have a healthy community that supports them where they are.
Yeah.
I'm going to have to jump in now. Thank you both so much. I hate cutting this short, but we are at time. If you all could join me in thanking Jacqui and Maria for giving of your time today, for showing the importance of uplifting the humanity of caregivers and your efforts to ensure that human rights of caregivers are secured. Thank you so much. And I will just share my screen briefly so that you all can see to the next session. We have a 10-minute break, and then we will start our closing plenary at 4 p.m. East Coast, 1 p.m. Pacific. Again, Maria and Jacqui, thank you so much.
Thank you so much for inviting us. Thank you.
Bye, Jacqui.
Bye, Maria.